Alright team, we've got a patient with some unusual symptoms.
Non-peripheral mastitis, osteitis, and bronchiolitis.
What do you think?
Well, non-peripheral mastitis could point to an infection. Osteitis could suggest inflammation of the bone, and bronchiolitis is inflammation in the lungs. It's a tricky one.
Maybe it's an autoimmune response affecting multiple systems.
But what about the familial aspect? Could it be something genetic?
You're all off the mark. It's familial male, limited precocious puberty.
But those symptoms don't match up at all.
Are you sure, Hawks? It seems like a stretch.
I'm not convinced. We could be risking the patient's life here.
Damn it. I'm the lead doctor here and I know what I'm talking about. We're doing a frenectomy, no arguments. It's risky, but it's our best shot. Now, let's save this patient's life. Tracy, I need to talk to you about my patient. I believe he has familial male, limited precocious puberty, and I want to perform frenectomy on it.
Hawks, hold on a minute. Are you sure about this? Have you considered all the options and risks associated with such a procedure?
Tracy, I've been a doctor for over 15 years. I know what I'm doing. Trust me, this is the best course of action for my patient.
I understand your experience, Hawks, but we need to be cautious. Let's have a discussion about this before making any decisions that could have serious consequences.
I can't believe you're questioning me after all these years. I know what's best for my patients, and I won't let anyone stand in the way of providing them with the best care possible.
Hawks, I'm not trying to undermine your expertise. I just want to make sure we explore all the options and consider the risks involved. Let's work together on this to ensure the best outcome for the patient.
How could this happen? The patient is in critical condition. I need to tell Hawks that the frenectomy was not the correct treatment for familial male, limited precocious puberty. I have to make this right.
What the hell were you thinking, you idiots? You almost killed our patient with your incompetent choices during the frenectomy. Wrong diagnosis, wrong procedure.
But, Dr. Hawks, we were just following the symptoms and...
I still think it was a case of rare oral cancer, not just a simple case of frenectomy.
No, I still believe it was definitely a case of severe infection that needed immediate treatment.
Shut up, all of you. You're all clueless. I can't believe. I trusted you three morons to handle this disgrace to this profession. I'm out of here before I lose my damn mind listening to your idiotic theories. I can't believe I haven't figured out what's wrong with the patient yet.
Maybe you should try checking their blood pressure again, or run another blood test.
I already tried that, Johnson. It's not as simple as it seems.
Well, have you considered a possible infection? Or a genetic disorder?
Wait a minute. I think I know what it is. Thanks for the suggestions, Johnson.
Wait, what? Where are you going?
Cleaves abruptly without saying goodbye. I have a new diagnosis for this patient. It's not familial male, limited precocious puberty.
Hawks, what are you doing? You can't just storm in here without proper gear.
Yeah, this is serious. You could compromise the patient's safety.
Hawks, you need to follow protocol in the operating room.
Trust me on this one. It's acrofrontofacial dysostosis, not what we originally thought. I finally figured out the right diagnosis for the patient.
Congratulations, Hawks. That's great news.
If you had just listened to me from the beginning, we wouldn't have gone through all that trouble.
But Hawks, the wrong diagnosis could have cost the patient their life.
You should have trusted my expertise, Tracy.
And you should have trusted my instincts, Hawks.
This could have all been avoided if you had just believed in me.
We both made mistakes, Hawks. Let's learn from this and move forward.